Hi, I'm going to be answering a question I received recently from a patient regarding dry needling. The patient asked, what is the difference between dry needling and acupuncture? The main difference between dry needling and acupuncture is in the methodology. The needles are exactly the same. However, in acupuncture, the needles are placed according to Chinese energy meridians, which in Chinese medicine are believed to be pathways where energy flows. In Chinese medicine, they call it qi. In Chinese medicine, they believe that in order for a human being to be healthy, the qi that flows through those meridians has to be flowing optimally. And if there's a disruption or an impediment or reduction in the flow of that qi, that can cause pathological states, digestive problems, psychological problems, musculoskeletal problems, pain, etc. They believe it can affect any system of the body. So acupuncturists, when they use acupuncture needles, they're examining the patient and they're determining where that qi is disrupted, where there is a blockage. And they're putting the acupuncture needles in the locations where there is a disruption to free up the flow of that qi. So acupuncturists, when they're using acupuncture needles, their approach is a more Eastern Chinese-based approach. And the practitioners that do acupuncture are called acupuncturists. So there's a little bit of a semantics at play as well. So dry needling is done mostly by physical therapists. It can be done by chiropractors and physicians as well. But since I'm a physical therapist, I'm going to speak through the eyes of a physical therapist. In physical therapy, when we do dry needling, we use more of a Western approach. It's more tissue-based, anatomy-based, structure-based. So we are examining a patient and finding where there is a restriction of muscle fibers, of fascia, scarring, any type of physical restriction. And we're putting those needles in locations based on anatomy and palpation exam. So we're using the needles to free up restrictions, essentially, based on an anatomical, tissue-based or structural model, as opposed to acupuncture, which is more based on the Chinese model of the flow of qi and freeing that up. So those are the main differences, but the needles are the same. It's just the map that's being used and the intent behind the placement of those needles. There are a little bit more details that go into this, but that's a general overview regarding differences between dry needling and acupuncture.